Hello, in this video, I'll be talking about what you should do if you don't like your medical team. Before I do, I'd love to invite you to our channel. We have lots of content about things like working with your medical team, what happens if trust is broken, and other similar topics, as well as some real nitty-gritty medical stuff as well. I'd also love to invite you to go to yerbba.com to get your personalized Yerbba report. So there are lots of reasons why you might not like your medical team. And by this I mean your doctor, your nurse practitioner, your nurse, just the whole vibe. Or you may like one of the team members but not the other. So I'll just call this your medical team. Why might you have problems? So I want to normalize things you may have experienced. First of all, if you have a medical team you love, you can stop watching here. If you have somebody on your team who cuts you off, doesn't speak in a way you understand, doesn't answer your questions, or sometimes it just takes one comment that doesn't sit right with you, that might be one reason you don't like your medical team. It can be sort of what used to be called bedside manner. Of course, now you're in the outpatient setting most of the time and there's no bed, but we still call it bedside manner. Bedside manner refers to things like making eye contact, answering questions, treating you with dignity. It might be things like getting back to you quickly enough, or even the way the physical exam is done, where it respects your bodily autonomy. All of those things can be off for you. So that might be one scenario, that sort of interpersonal, humanistic side of the team. And again, you may really get along well with the physician assistant, nurse practitioner, but the physician rubs you the wrong way, or the other way around. Or it could be somebody else on the team where you just don't have a great feeling. You may also have misalignment with what's being recommended. So let's say you prefer a more holistic approach and the medical team comes across as, no, you have to do this or else. You have to do this or you can't be our patient, or you have to do this or you're foolish. That kind of thing can be really hard as well. That's not just a bedside manner issue, it's also a shared decision-making issue. You may also feel that your medical team is not as up to date as you would like them to be on the newest research or newest advances in the way people are treated with your type of cancer. And that can come across if somebody changes the subject quickly, or they say, we don't do that here. You can always ask, why don't you do that here? Or have you used this before? What are your thoughts about? Instead of closed questions, you can just explore a little more. It's really important to know that all of us can have bad days. Just like you can have a bad day, your doctor can have a bad day, your nurse can have a bad day. So if you don't like your team when you first meet them, it's a hassle to change. You can stay and give them another appointment and see how things go. Or let's say things have been going really well and then you have an off appointment where things don't feel right. That may be because there's something else going on, not just in one person's life, but maybe in the whole setting, maybe the whole hospital or the whole practice. There can be sad things that happen or really upsetting things that happen, and you might be picking up on some of those vibes. So that's just an aside, but I think it's an important one. And if you ask your team, is everything okay, you might actually find out what's going on, and that can be very helpful as well, or they may not want to share because it's private. So there are a lot of things going on behind the scenes. But let's say this is really clear, this is not the team for you, or again, you might like one member, but the overall team isn't going to work out for you. What kinds of things should you do? Well, there are a couple options. One is you can consider switching, and the other is you can consider staying with the team and working on that relationship. It feels so strange to talk to you about working on anything. You're going through something extraordinary, but not everybody has the chance to switch to another team. If you live in a remote area, or more common, if your insurance requires that you get your care in a certain place, that option to change teams may not be there for you. So let's talk for a few minutes about what you can do if you're going to stay with the team and something bad happened. The first thing that I recommend you consider doing if you feel safe is having an honest conversation. You can make an observation. Last time I was here, I was interrupted a lot. Last time I was here, when I asked about this, you said this. No judgment words, just the facts, just an observation. Then you describe the impact. The impact that had on me is I felt small, or the impact that had on me is I felt rushed, or I felt like I wasn't important to you. So you describe the observation, the impact, and then you make a request. Do you think in the future you would be able to spend the time answering my questions? Or do you think we're a good team together? It's kind of a request shrouded in a yes-no question, right? It's like saying, are we a good team? I'm checking you out here. So you want to make a request for something you need, something to change. That's a great way to start. It actually can reset things entirely, and things can switch to the place where you can have even a stronger relationship than you did before. Again, why should this be on you? You're the one going through cancer treatment, or your loved one's going through cancer treatment, because you don't have a lot of other choices. This part of the conversation is assuming you're going to stay with the team you have for whatever reason. The next thing you can do is you can write a letter. And it's not a letter, again, with a lot of judgment, because you don't know what's necessarily going on. You can talk with a practice manager. You can talk with a social worker. Again, if you don't feel safe talking directly with the person who upset you, you can talk to one of the other people on the team. You can talk to the person with whom you do get along. They really should ask your permission to talk to another person, but you can also just give that. I would love it if you would talk to Dr. So-and-so. This is how I felt. I would love it if you would talk with your practice manager, because the front desk staff is always really angry with me. You can ask for some help. They are your team as a whole. You don't want to make assumptions, so see if maybe there's something you don't understand. Help me understand your system for setting up scans and when I should expect a call. Let's say you expected a call the day after your appointment and you didn't get it till the next week. What are the expectations that I should have? When should I call if I don't hear from you? So a little give and take can actually help you feel less armored up and angry, not making assumptions, asking questions, seeing if your expectations are realistic, giving some grace to the team, and then asking for what you need. That observation impact request formula, if you will, is really effective, and not just with your medical team. You can use this with your kids, your partner, and at work and in your neighborhood as well. Now, what if it is time to leave? You're going to leave. This just isn't workable. You've tried all these other things and you're going to leave. Making that transition, there are a couple things I want to make sure you know. The first is your medical records should precede your body. They should get all the information about you before you physically see them. Otherwise, they're going to be really unclear. The other thing that can be helpful is to be really honest with why you left the previous team. It will help them know what your needs are. So you can say, I left the previous physician because they didn't give me enough time. They didn't answer my questions. Or I'm leaving because at the office, they don't return calls within 3 days, which feels realistic to me. So be very clear and find out if your expectations can be met at the new place. You might think maybe I should do that ahead of time. It's really hard to have those conversations before you're actually in the office. I have to be really honest with you. It's really hard to get a call back. Sometimes a coordinator can be useful in those sorts of questions before you go. So your medical records need to go first. You want to tell them why you're leaving. You want to make sure you know everything that has been done so you can validate what they're seeing in the record. And one thing that can help is, I'm just going to bring it up again, Yerbba.com can give you your personalized report, which will tell you everything that's been done and everything, all the test results, everything's in there. So in addition to all the medical records that get sent ahead of you, you can sort of go through the story. And that's my final point, is write your story out very clearly. Try not to go around and around. And I know this is hard, but try to leave emotions out of the room, because what you want to do is create a new relationship. So you may be furious with the other place, humiliated, your dignity may have been violated. You want to start off on a good foot. And so if you can, process those very real emotions and feelings and thoughts with somebody, and it might be the social worker at the new practice if you find you're getting stuck, but start the relationship off with a clean slate. I've covered a lot. I hope it's been helpful to you. Drop a comment or question below. Let me know if this resonates. Let us know what else you'd like to see. Do you have a specific circumstance we can respond to? Share your experiences with switching or staying with the Yerbba community. As always, thank you for watching.